Hello. We speak about the principles of complex treatment of periodontitis and indications and contraindications for conservative treatment of periodontitis and general treatment of periodontitis. Goal of today's lecture to acquaint students with principles of complex treatment and various methods of periodontitis treatment. Methods of treatment periodontal disease may be first conservative, medication or physiotherapy, surgical, and a combination of surgical and conservative treatment. Absolute contraindications for conservative treatment of periodontitis. Indications for tooth extraction. First, increase in acute inflammatory response despite trepanation and antibiotic therapy. Cyst with diameter of more than 2 centimeters, or cysts spotted into the maxillary sinus. Third degree of tooth mobility. The next contraindications: deep bone pocket and communication with the periapical region. The next contraindications: tooth fracture below 3 millimeters under the gum. And the next exacerbations of somatic disease with focal etiology. And the next, damage to the heart valve. Relative contraindications to the conservative treatment of periodontitis. Repeatedly exacerbations of periodontitis. The next, impossible spacecraft dye to sharp root curvature, tool fragments, and obliterations of root canal. The next contraindications: previously obturated root canal, not amenable to unsealing. The next, perforations of the wall bottom of the cavity of root tooth. The next contraindications: resorption of hard tooth tissues, internal, external, interroot. The next contraindications: the presence of a stabilized disease with focal etiology. The principles of periodontitis treatment. First principles: dental therapy. It is the use of anesthesia, the use of drugs in safe concentrations. The next principles: complexity. It is a combination of all types of treatment, general and local, heterotropic, pathogenetic, and symptomatic. The next, combination medication, physiotherapy, and surgical treatment. The next principles: sequence, exact observance of all stages of endodontic interventions. The principles of triple exposure, principles by Lukomsky. First principles on macrocanals. Instrumental, it is the fractional removal of decay and intracanal associated dentin. and medications, enzymes, use enzymes, antiseptic and other drugs. On microcanal, sterilization of microcanals by physical, such as depaphoresis, and chemical drugs, hypochlorite of natri, calcium hydroxide, and methods hermetic obstruction of root canal. The next principles for periodontium. It is the anti-inflammatory and osteostimulation substance, physiotherapy, transapical surgical treatment. Now we speak about general treatment of periodontitis. General treatment may be contain some step. Heterotropic, you use antibacterial agents, and pathogenetic treatment. Use non-steroidal anti-inflammatory drugs or steroidal drugs, and use antihistamines drugs. Groups of drugs for general treatment. Antibacterial drugs. It may be antibiotics and antifungal. Anti-inflammatory drugs, non-steroidal anti-inflammatory drugs, and steroidal anti-inflammatory drugs and antihistamines drugs. And the next group, anabolic drugs. It may be vitamins, immunostimulations, and adaptogens drugs. The main groups of antibiotics that are effective against the virulent microbial flora of the oral cavity. First, a group of lincomycin. The next, beta-lactam antibiotics. Third group, broad-spectrum antibiotics such as tetracycline group. Fourth group, drugs of the imidazole group. And 5 group, microlids. Requirements for antibacterial drugs. Impact on the maximum spectrum of microorganisms in the lesion, and accumulations in inflamed tissues, low toxicity and higher bioavailability. The main rule for choosing the optimal antibiotic dosage and durations of the treatment. First, low doses of drugs lead to an unsuccessful treatment result, but too high doses lead to a toxic effect and risk of allergy. And follow the recommendations for a combinations of antibiotic and food intake. It is important to remember antibiotics shall be used strictly according to indications. Suppurations, abscessing, progressive destruction of the bone tissues. Next, condition before and after surgery. The dose of antibiotics shall depend on the body weight age, and general health status of the patients. Sixth rules. It is necessary to correlate the side effect of the selected drugs and the general condition of the patients. 7 rules. To take into account the synergism and or antagonism in combinations with other drugs. Principles of antibacterial therapy. The appointment of antifungal drugs such as Flumian, Diflucan, Nizoral, Arungal, and others. Second principles, appointment of eubiotics, probiotics, or prebiotics, such as Linux, Hilac Forte, Dufalac, and other preparates. Next, appointment of desensitizing drugs, Claritin, Cysteine, and Cetrin, and other preparates. The next principles, appointment of the vitamins, and 5, combinate with sorbents. Antibiotics, for example, lincomycin hydrochloride, you see doses and durations of this preparate. Clindamycin, you see doses and durations with preparate too. Cifranes with tinidazole and Cipralet A, very popular preparate today for treatment acute and exacerbation of chronic periodontitis. Durations by 500 milligrams or 1 tablet by 2 times on day. The next group preparate for general treatment, non-steroidal anti-inflammatory drugs. Actions with preparate. They inhibit the activity of certain enzymes involved in the formation of inflammatory mediators, and they have a stabilizing effect on the membranes of lysozymes and cytostatic effects. Prescribe the following non-steroidal anti-inflammatory drugs. Ketarol, nice, very popular. This preparation durated by 1 tablet 2 times on day. The next group for general treatment, steroids, anti-inflammatory drugs. Actions with preparate. Inhibit the inflammatory response, reduce the permeability of the vascular wall and tissues, reduce diapedesis and cellular activity, inhibit phagocytosis, reduce swelling and the allergic components of inflammations. Indications for steroids use. This preparate used only in acute stages of inflammation with a predominance of hypergic reactions. Glucocorticoids impractical to apply at a sluggish process and also when the suppurations and abscess formations. It is very important informations. The next group, antihistamines preparate. Actions with drugs. They suppress the action of free histamine. When an allergen enters the body, histamine is released from the mast cells of connective tissues that are part of the body's immune systems. It begins to interact with specific receptors and causes itching, swelling, rashes, and other allergic manifestations. Antihistamines are responsible for blocking these receptors. You see modern antihistamines drugs in Russia, Suprastin, Tavigil, and other preparates. You see on picture antihistamines preparated by first generations. There are 3 generations by antihistamine preparate. Dimidrol, Tavigil, Suprastin are the drugs from first generations. Antihistamines of the first generations are characterized by the following pharmacological properties: reduce muscle tone, have a sedative, hypnotic, and cholinergic effects, and enhance the effects of alcohol. They have a local anesthetic effect, give a quick and strong but short-term, only 4 to 8 hours, therapeutic effects. And long-term use reduce antihistamine activity, so the drugs is changed every 2 or 3 weeks. On next picture, you can see the name antihistamine drugs by second and third generations, such as Arius, Chloritin, Telfast, Zyrtec, Kystin. These preparates have some advantages in comparison with drugs of the first generations. There is no sedative or cholinergic effects. Since these drugs do not overcome the blood-brain barrier. Only some individuals experience moderate drowsiness. And they have mental activity, physical activity, which do not suffer. The effects of the drugs reaches 24 hours, so they are taken once a day, and they are not addictive, which allows you to assume them for a long time, free by 12 months. When you stop taking drugs, the therapeutic effects last about a week, and medicine are not absorbed with food in the digestive tract. But antihistamines of the second generation have a cardiotoxic effect of various degrees. So, heart activity is monitored when they are taken, and there are contraindications in older patients suffering from disorders of the cardiovascular systems. Third generation antihistamines. These substances are prodrugs. they are converted from the original form into pharmacologically active metabolites when they enter the body. All antihistamines of the third generations do not have a cardiotoxic or sedative effect, so they can be used by people whose activity is associated with higher concentrations of attention. And these drugs block H1 receptors and also have an additional effect on allergic manifestations. And they have a high selectivity, do not overcome the blood-brain barrier, so they do not have negative consequence from the central nervous systems. There is no side effect on the heart by this preparate. Without this preparate, very popular today for general treatment of periodontitis. The next, the standard scheme of treatment for apical periodontitis, and this scheme consists of 3 stages. First stage, preparations. The affected tooth, introduction of local anesthesia, remove and the root canal, necrotic pulp removed and the root canal cleaned by these products. The next stage, antiseptic treatment. Use anti-inflammatory and antibacterial drugs for medical treatment of root canal. And the third stage, sealing of canals. After the blocked or ended anti-inflammatory, you must carefully seal root canal, and the tooth is sealed or may be made orthopedic crown if the crown of tooth very lesion. Thank you for your attention.